preparing live stream, preparing the live stream, setting up meeting for Facebook Live, setting up your mail. Done.
Namaste. A very good morning to one and all. We Team Firecrackers, along with the students of 34th batch of Ncdc, warmly welcome you all for the celebration of Kerala Day, otherwise known as Kerala Piravi. As we all know, November 1st is celebrated as Kerala Day or Kerala Piravi. Kerala Piravi is celebrated to commemorate the birth of Kerala as an independent state in the Republic of India on November 1st, 1956. So let's start the celebration with a Tiruvadira Kali. Tiruvadira Kali or Kaikutti Kali is a unique dance form in Kerala performed on the auspicious occasion of Tiruvadira, the birthday of Lord Shiva. Come on, let's see that. Thank you all. Thank you.
Wow. Wonderful.
Super. Thank you.
It was really nice. Enjoyed a lot. Super.
Thank you. Yes. Now let's continue the program with Soumya ma'am.
Amma?
Mute.
It is believed that Kerala was formed by Parashuraman, the sixth incarnation of Lord Mahavishnu. According to Hindu mythology, Parashu threw his axe across the sea northward from Kanyakumari to carve a land, the place where the axe landed formed Kerala.
Okay, Soumya ma'am. Okay, Soumya ma'am. Now, Kerala has a rich culture and heritage, which is so well preserved by the locals. Unique beauty of Kerala is not only reflected in its glistening water and like bodies and virgin forests, but also its culture and Kerala dance forms. Let us see some of the dance form of Kerala. Okay, our teams and dance forms, welcome. I just welcome Wonders. Welcome, show us some
Welcome,
forms.
Wonders. Welcome,
Welcome.
welcome.
Wonders.
Let's welcome Blasters first.
Okay, just I will welcome Blasters first.
Yeah.
Blasters. Welcome.
Wonderful performance by Blasters.
All the best, team. All the best.
Wow.
Wow.
Wonderful performance by Blasters.
Great performance.
Thank you, everyone.
An energetic performance.
Such a wonderful performance it
We
was.
really enjoyed your performance. Super. Well done, everyone.
Yes.
Okay.
Performance. Well done, everyone. Well done, everyone.
Okay, next, I will welcome Wonders. Wonders, please show some dance form.
Welcome.
Welcome, Wonders.
Thank you.
Thank you.
performance it was.
Wow, great.
Well done. Super performance.
Thank you. Thank you so
Super.
much, everyone. This is
Super.
the dance form. This is a dance form called Magangali.
Wow.
So this is an ancient Indian round dance of the St. Thomas Christians community, and this was mainly based on our Kerala state, and here it will be performed in celebrated there in their celebrated days, and for it is performed as a celebration in their community. Thank you. And
Wow,
also,
Super.
Thank you, Shafna ma'am, for that information. Thank you so much.
yes, ma'am.
Superb.
Just a
great
minute.
information.
Just 2 points to add.
Yes.
Mostly this art form is done by in older days. This is done by male, that is gents, and after that nowadays women are following this dance form, and during their marriage and festivals, the previous day of their marriage, they will conduct this dance form in their homes around this, like Hindu people have this tulasi tara, like that they have that kurisha tara, and in front around that they are like dancing this, used to dance around this kurisha tara.
Wow, thank you, ma'am.
Superb.
Wow, Auntie ma'am. Thank you for that.
Great information.
Okay,
Great
superb, ma'am. Superb.
Thank you, ma'am.
Okay. Now, sir, come on. Sir.
Welcome, sir.
Yes, let's see
welcome.
what Sir has to perform.
Show
One of the
some
dance
dance form.
forms.
Yes.
Welcome, sir.
Wow,
Yay. That was a dance form of Tripura. Yay.
Wow,
Well
super.
done, sir. Well done, well done.
Well done, guys. Well done, sir. Okay. Now, everyone enjoyed?
Yeah,
Enjoyed?
Yes, of course we enjoyed such a
Wonderful.
mesmerizing and
I think
amazing
I have-
performances by
Oh,
all.
yeah. A super performance.
Yeah.
And I think we can enjoy with very game show. Okay? We
Yes,
can
the
enjoy.
celebration continues with some game show.
Yay!
Let's welcome Team Blasters.
Yes. Come on, guys.
Welcome Team Blasters.
Blasters.
Here comes the blasters. Thank you,
Yeah.
everyone.
Welcome, blasters. Welcome.
Thank you, everyone.
Firecrackers. Thank you, everyone.
So as mentioned by our anchors, tomorrow it's our Kerala Piravi. So let's start with a little of general knowledge questions. It's a quiz program, Kerala quiz. And the team will be Firecrackers, Team 1, Team A, then Wonders 4, Team B, then Sarg, Team C. Yo! Wonders and Fire, yes. So it's questions related to our Kerala history and about Kerala. So shall we start? Are you ready, team members?
Yeah, sure.
Yes.
I need that beat. Yo, get ready fast. Yo. That spirit should be there.
Yo.
Yeah, there it is. Okay, so let's start. The first question goes to Firecrackers. And the question is, who was the first Chief Minister of Kerala? Firecrackers. Who was the
EMS
first
Namboodiripadu.
Chief Minister of Kerala?
EMS Namboodiripadu is the chief
Yes,
minister.
correct.
Yay! Firecrackers, we got one. Yo.
One point, Firecrackers. Now, the next question goes to Wonders 4. Wonders 4, are you ready?
Yes, come on.
Yes.
The longest river in Kerala. Wonders 4, the question I repeat. The longest river in Kerala. Wonders 4. Come on.
Bharatapura.
Muted.
You are mute.
I'm sorry, you missed the chance. Sorry, the question will be passed to Team Sarg. The longest river of Kerala. Come on, Team Sarg. Team Sarg, no? No response from Team Sarg. Shall I pass the question? Shall I pass the question? Firecrackers coded.
Firecrackers.
Yay!
My God, Firecrackers, you are leading.
Yes.
Now the third question goes to Team Sarg. Team Sarg, please listen to the question. When was the Kerala state formed? The year and the date. When was the Kerala state formed? Come on, Sarg.
My intro.
Sarg,
Come on.
it was there. You got the hint. Kerala state formed. Or when is the Kerala Piravi?
1956 number 1.
No, ma'am, it's there.
No question. So, Firecrackers, 0.5 deducted from you. Now, sir, do you know the answer?
No, sorry.
Okay, so I'm passing the question back to Firecrackers. Now you can say.
Yes, Soumya ma'am, now you can say the answer. Say, ma'am. You told, no?
Come on. No, she didn't tell completely. Come on.
November 1st, 1956.
Okay, done. Yo, Firecrackers.
Yay, again.
Yay!
Go back the point.
Yeah, you scored back the lowest half marks. Now, the next question goes to Firecrackers. The question is, the Nehru Trophy boat race is held in which lake? Firecrackers.
Come on.
Nehru Trophy boat race. Nehru
Kayal, no?
Trophy boat race. Yeah.
Vemparattu Kayal?
Wrong. The question is Wonders 4.
You knew it, Amartha ma'am.
Nehru Trophy boat race is held in which lake? Yes.
Punnamada Lake.
Yes. Gujarati lake.
Well done.
One point.
Half mark.
Okay. Past question. Okay, half mark.
Yes. Now the next question goes to Wonders 4. Then, who is the father of Malayalam language? Wonders 4.
Eഴുത്തച്ഛൻ.
Yes, very good. Ncdc. Wonders 4.
Yo.
Yes. Now, the next question goes to Team Sarg, which is Asia's first arch dam that was constructed across the Kuravan and Kurati hills. Sarg, Team Sarg. Albrina ma'am and all. Savita ma'am, Rishmi ma'am. Asia's first arch dam that was constructed across the Kuravan and Kurati hills. Now it's in news. Come on, Team Sarg. Come on, Team.
Oh, it's in news? Okay. Then okay.
Come on, Team Sarg. Asia's first arch dam that was constructed across.
No, it's our chance.
It's only for Team Sarg. Come on, Team Sarg. I have given the clue. Nowadays it's in news. First arch dam. Team Sarg, come on, come forward. Across
Come
the
on, try.
Kurati hills.
Yeah, ma'am. Savita ma'am.
Savita
Alvina
ma'am,
ma'am.
Alvina ma'am, come forward.
Sir.
Anyone
Alvina ma'am.
answer. Anyone answer. Let it be wrong. No problem. Come on, come forward.
He's going to
Yeah.
So the question will be passed to firecracker.
Yo, Valla Periyar.
Wrong. That is overconfident. That is wrong. Now the question will be passed to Wonderful.
well done.
Come on,
No, it's not well done. We did it.
Idiki dam. Idiki dam.
Idiki dam.
Yes.
Valla Periyar was in news, no?
Idiki
also coming. Well done, Wonders.
Well done, Wonders. Well done.
Now, next, the question goes to firecrackers.
Yes.
Yeah. Which district of Kerala has longest coastline? Firecrackers.
Longest?
Coastline.
Yeah, come on.
Come on, firecrackers.
Ernakulam.
Which
Soumya ma'am.
district of Kerala has longest coastline?
Ernakulam.
No, the question will be passed to Wonders 4. Which district? Yes, come on, Wonders 4.
Is it Alapura?
Oh my God. No, the question will be passed to Team Sarg. Longest coastline.
I am the
Longest
cue.
coastline. Oh, no. Now anyone can answer. No.
Kannur.
Not Trivandrum. I think Kannada can still answer.
Wow, Kannur.
Yes, it's the longest beach is there in Kannur.
Yeah.
That I also know.
It will be Trivandrum itself.
Sorry, ma'am.
Coastline, Trivandrum?
No, ma'am. Kannur,
No,
ma'am.
ma'am, it's in Kannur. Kannur is
Kannur.
having the longest, in Kerala's longest beach is there in Kannur. I don't know the exact name of the beach.
Drive beach. That
Right. Murpilangadi something, no?
Yes.
That was some Angadi beach.
Yeah, Murpilangadi beach. Hey.
Now, few more questions. Now, next question goes to Wonders 4. Name the first Malayalam novel. Wonders 4. Malayalam novel. The first Malayalam novel.
Indulekha.
Sorry, the question passed to Team Sarg. Something related to that name. Team Sarg, come on. No. Now the question passed to firecrackers. No googling, nothing should be done. Firecrackers was the first Malayalam novel.
Where is Abarna ma'am's hand? Raise up.
Abarna ma'am, you know, I was also about to say Indulekha only, but it's
No,
not the
it's
answer.
something related to that. Anyone knows? In this
Something
group?
related to that.
Name similar. Name little bit similar. One letter is similar.
Indulekha.
So it starts with Ku. I'll give a hint.
Kundalada.
Yes. Kundalada.
Who said that?
Bharatiya ma'am.
Nobody got the point.
Kundalada.
Kundalada. Okay, it's written by.
First novel is Kundalada. Now the next question goes to team. Which one? I think Sarg, right?
Yeah, Wonders. This question goes to Wonders, no? So, Sarg.
So next question goes to Sarg. Yes. The largest lake in Kerala. Team Sarg. Largest lake. Some kayal. Yeah. Which Kyle? Which lake? The largest lake in Kerala. Team Sark.
Yes.
Right.
Hello.
Yes. Largest lake in Kerala. Team Sark.
Vembana.
Team Sark opens their box.
First one. First one.
Super. Well done. Now the next question goes to firecrackers.
Yes.
The first Malayalam film in India. The first Malayalam film.
Balan.
Team firecrackers.
No.
Balan.
No. That is the movie with sound. The first Malayalam film.
Vigata Kumara. Vigata Kumara.
My teammate is saying something.
Vigata Kumaran, yes.
Yes, because of
But now well said. You can take half point because one wrong, one right.
Since you said the wrong answer first.
Half point. You can give half point.
Only half. Now the next question goes to Wonders 4. The gateway of Wayanad is dash. Wonders 4. The gateway of Wayanad.
Options, please.
No options. No options.
Gateway of
It's very known. It's very well known. Gateway of Wayanad.
Yes,
One famous Malayalam scriptwriter, Lohitadas' native place is there. That is one clue I can give you. He used to sit there and write. Most of his novels and all he used to mention that place name. The gateway of Wayanad. No idea. The question will be passed to Sark. Team Sark.
No idea.
No idea. Now what about? Yes.
Savita ma'am. Yes.
What,
Well done,
Lekkadi.
Lakkadi viewpoint. See, Savita ma'am is explaining.
Wow. Well done.
Superb, ma'am.
Super. Now I think the last and the final question that is going to, I think, Team Sarg, no? Yeah. Team Sarg, right? Yes.
Yes, ma'am.
Yeah. So this was the past question. Which festival of Kerala marks the New Year? The Malayalam New Year. Which festival of Kerala marks the New Year?
Yeah.
Come on, Team Sarg. Malayalam New Year. Which
Malayalam
festival?
New Year.
Yeah, Malayalam New Year.
Come on, team
Come
sir.
on, Team
Come
Sarg.
on.
Alrina ma'am. Savita
Yes,
ma'am,
you
come
can.
on. You can do
Savita
it.
ma'am. Savita ma'am.
Savita ma'am is thinking. Malayalam. No, Malayalam New Year. What
festival, ma'am?
Festival.
Festival ma'am. We need. Tick tick 1, tick tick 2, tick tick 3.
Sorry.
You will get it. Think. Other.
Wow, see what? To firecrackers. Come on, open the map.
Firecrackers.
Visha.
Yes, it's you. So I think we have come to an end of this wonderful, joyful, enjoyable festival.
It was really fun.
And the scoreboard, Hadia ma'am.
Yes, show the score.
Yeah. 1, 2. So shall I reveal?
Yes, ma'am.
Yes,
ma'am.
Okay.
Only tell the winner, ma'am.
No, every box I will say. First team, not first. Team Sark scored 1.5 marks.
Yay! Well done, teacher. Well done.
Well done, guys.
Now, Team Wonders 4 scored 2 marks.
Yay! Well done.
Well done. And finally, the winner, Firecrackers, scored 3.5.
High five.
Well done,
Well done, everyone.
Well done.
Thank you so much, Blasters, for such an enjoyable, wonderful quiz.
Informative. Don't forget.
Yeah, it was informative also.
Yes.
Don't forget.
Thank you so much for that.
Thank you everyone for your wonderful participation.
Thank you for wonderful games.
Yeah, thank you,
Yes.
ma'am. Welcome. Thank you. Yes.
Superb, Safna ma'am.
Thank you, ma'am. Thank you.
Then come on.
Yes. So our next game is sari folding.
Yes.
So who all brought saris?
Wow.
Yes, ma'am.
Please spotlight them. Those who have got 3 or 4 saris.
Sufeja
Shafna.
ma'am, Shafna ma'am,
Soumya
Soumya
ma'am.
ma'am.
Soumya
Soumya ma'am
ma'am.
is also having it.
Soumya ma'am. Unfold your saris first.
Yeah, unfold it completely.
Yes. Show it like this.
Yeah. All the 3 saris you have to unfold and keep.
Yes.
It's better to take cotton one, I think. No, the other one it will slip from hands.
Every sari you have to keep like that.
Where is Shafna ma'am has not been spotlighted, ma'am. Please spotlight Shafna. Yeah, thank you. Shafna ma'am.
Yeah, I'm
Where
here.
are you, Shafna ma'am? Yes.
I'm here, ma'am. I'm here. Yay.
Unfolded, no? Fully? Yes.
First, we want to check. Sometimes
Open
Check
it.
all the 3 saris. All the 3 saris.
All the 3 saris you have to unfold.
ma'am, please check the timer, okay?
Yes, ma'am. Yes.
Yes, Shafna ma'am, one sari unfolded. Soumya ma'am's 2
Second
saris.
sari first. This
Yeah,
one.
okay. Second white, first green. And Sufeja ma'am's also
1 minute,
unfolded.
no? How much time within?
2
Within
minutes,
3 minutes, ma'am.
3 minutes.
3
ma'am.
minutes. Okay, I will keep the timer. Okay, your
Okay,
time
ma'am.
started now.
Okay, all 3 we have to do in.
Yes, yes. Maximum number who are doing, they will be the winner. Folding, ma'am. Just folding.
Folding.
Folding, not draping. Not draping. Folding the sari. Folding, not draping.
Oh my
Yes.
God, this is very.
I don't know that kind of sari is very difficult to fold.
Yes,
Soumya
yes,
ma'am,
that
Soumya
chiffon
ma'am
one
is
is
showing
very
very expert in
Up, Sufeja ma'am. Up, Shafna ma'am. Up, Soumya ma'am.
Up, Shafna
Come on,
ma'am.
fast. Sufeja ma'am. It's done. First one done.
Sufeja
You will check whether it's folded correctly, okay? You have to hold it properly.
Hold it neatly. Hold it neatly.
Up.
Fold it neatly.
Yes, Sufeja ma'am.
Come on, Soumya ma'am. Shafna ma'am, Sufeja
Up,
ma'am.
Shafna ma'am. Up,
Yes,
Sufeja
up,
ma'am.
up.
Up, Soumya ma'am.
Sufeja
Yes,
ma'am.
fast.
Soumya ma'am. Shafna ma'am. Come on.
Come on. Yes,
Yes, Soumya ma'am. Shafna ma'am.
Soumya ma'am is with blue sari, Shafna ma'am is with white sari, and Sufeja ma'am with black
Yes.
sari.
Black.
Yes.
And
We
the
have a
competition
colorful
is-
rainbow
competition
colors
is
here
becoming
now.
tight. Competition is becoming tight. Sufeja
Yes,
ma'am.
Sufeja ma'am. Our second one is also
Soumya
done.
ma'am is doing
Come
it
on,
very
come on.
Sufeja ma'am
fast.
is taking a yellow color sari. Yes. And Sufeja ma'am is keen interested in folding the saris. Soumya ma'am also completed.
Soumya ma'am is also second. Yes.
Started the third one.
Soumya ma'am is also done with second one.
It's a dark maroon color sari, and Shafna ma'am is not with.
Sufeja ma'am.
Up, Shafna ma'am. Shafna ma'am.
Soumya ma'am.
Up.
Sufeja ma'am is.
Yes, you can do it. Oh, Soumya ma'am is done. Yay.
Completed.
Yes, okay, ma'am, fast. 2 minutes.
Shafna ma'am too. Shafna ma'am too. And finally Sufeja ma'am. Three, no?
Yeah, 3 is enough. 3 is enough. 3 minutes.
Yes,
Enough,
yes.
ma'am,
Within 2 minutes. Time I
Yeah.
have set.
I think Soumya ma'am, no?
Enough, Shafna
Soumya ma'am is the winner.
Yo, Soumya ma'am.
Shafna ma'am. And the third
Well done, three of you. Well done.
Well done, three of you. Well done. Superb.
Wonderful performance. Well participated. Thank you very much for your participation. Superb. Now, let's move to the third game. Sufeja ma'am.
Yes.
Yes, last one.
Yes. We have one another game. All of you, please take one pen and paper.
Pen and paper or pen or
Pen.
paper?
Pen, ma'am. Pen and paper.
Yes.
Okay, ma'am.
Meryl ma'am, you can off your virtual background. Yes. So Feja ma'am is ready. Meryl ma'am is ready. And Soumya ma'am, Aarati ma'am.
Aldrina ma'am is there, ma'am. Aldrina.
Yeah, Aldrina ma'am, you also. She didn't participate. What about Savita ma'am? Come on,
Yeah, come on,
participate.
Savita ma'am, Aldrina ma'am.
Everyone can do.
Yeah, everyone.
Yeah, with paper and pen also, I think everyone
Paper and a
can do.
pen.
Yeah, then everyone can.
Everyone can do.
Yes. I am saying one word and write that word in your paper. Okay.
It will be very, very difficult, but sure, pakka.
We have to write that word. Okay.
Yes, ma'am.
Otherwise, we can type it in the chat box also, no, ma'am? So, Feja ma'am.
Yeah, let's dictation.
Yeah.
Dictation. Oh my God. You should have already told. Then you will be prepared. Okay, come on.
God.
Flossinocini hilification. This is the word.
And everyone repeat.
Repeat. Stop.
Flossinocini hilification.
Come.
First starting.
Hilification.
Chlorinohelification.
So, Feja ma'am, you can
Hilification.
write the spelling so that it will be easy for them.
Yes, ma'am. I'm already right.
Show us. We will write. You can write.
Diagram,
No.
ma'am.
Hey, no, Feja ma'am, no.
Flosino. It's F.
Yes, ma'am.
Flosino. Okay.
Yes.
Flosinohelification.
Yes.
Flosinohelification or flosinohelification?
Flossinocini hilification. He.
Okay. I am done. Whatever I heard, I am done.
Yes, done. Hope this is yes.
So, Feja ma'am, can you spell that word? Then it will be easier. So they
Chat
can make.
box, ma'am.
The game
Chat
is that
box.
you have to make maximum word out of this word.
Oh, yeah.
I thought no, we have to make it correctly.
Oh, I
We have
thought
to
it
make
is dictation
three
or
letters
something.
and 4-letter words we have to make.
Then you have to tell the spelling, correct spelling. Then we will.
Tell the
That you
spelling.
can
I'm
put in the
typing.
chat
I'm
box.
typing it. I'm typing it. This word is a famous word. Can anyone guess?
Ma'am, you can do it in the whiteboard.
Chat box. Done.
This is the largest word.
Yeah, recently this word has become a bit viral. Can anyone know?
No.
Who is very good in English? With excellent linguistic skills. One of our politicians.
Shashi Tharoor. Shashi Tharoor, no? That word. Okay. We can use one word only one time.
Yeah, any letter.
So means same words can repeat, no? That is a problem? No?
Only that if I there are two, you can use I only 2 times.
That's right.
Yeah, that's it.
Why here so many eyes are there? No.
Yeah, if there are many eyes, that much a number only you can use in a particular word, in one word. That's it. Lots of letters are there. I think most of the alphabets are here. Let me also try.
Patient. Yes. Now the word is clear. Now I will keep the timer. Otherwise, you will take the whole day.
Any?
1 minute. Your time started now.
Okay.
3-letter words only.
3-letter and 4-letter
any,
words.
any letter word. 3
Yes,
letter and 4
maximum
letter.
words.
Just go, Baba.
Maximum words you can make. In any order you can take the alphabet.
Ma'am, you are keeping the timer, no?
Yes. 17 seconds over. "26 seconds done. Maximum words within a minute. 10 more seconds.
Oh my god, oh my god, oh my god. I'm not getting.
5 more seconds.
No.
Yes, 1 minute done. Come on, stop. Yes.
1, 2, 3,
Enough, Fatima. You can stop
6,
sharing.
7, 8, 9, 10, 11, 12.
My god, only
10
7
for
for
me.
me.
12.
7 for me.
1,
12 is the highest.
But don't kill me if you see my words. Okay? It's meaningful, but
Hadia ma'am, you can stop sharing, ma'am.
Okay,
Enough.
ma'am.
1 minute done. Yeah, now come on. Who got the maximum number of words?
I got 7.
I got
7,
7, 7.
7 I got, then 12.
11,
11.
Ma'am,
Oh,
10
Sapna
for
ma'am
me.
11, Arati ma'am 10.
10.
I got 9.
9,
9.
Soumya ma'am, super, super.
Yeah,
Namarina,
then
you have to
maximum
read it.
11 by.
now mine is on the screen. Hill, nation, lion, cat, in, on, un, fan,
What is this?
quotient, notion, hat.
2-letter words are not accepted. Only 3-letter and 4.
No. Sapna ma'am said any words.
So the maximum number of words by Arati ma'am. You can proceed your words, ma'am. Arati, come on. Yeah.
Yes, 2-letter is not possible, ma'am.
Okay, no
Any
problem.
is any. Okay, no.
Okay, ma'am.
Hill, location, on, in,
Oh,
and,
location.
account, flat, flip, float, hip.
Yes.
Hip I got, flip flap I didn't
Hip
do.
I didn't.
can I
Cat
got
is there, cat is there.
Cat
Fat,
for me, hat is there.
fat is
nation,
there, fat.
flop I got, cap I got, lip, net, plate, fat,
King is there.
lion.
Oh.
Yes. So the
Well
maximum
done,
number of words
Meryl
by
ma'am. Well
Arati
done,
ma'am.
super.
Come on.
Meryl ma'am,
Super,
Meryl ma'am, 12 words ma'am.
Meryl
Meryl ma'am and Arati ma'am,
Super
12
Meryl
words.
ma'am. Super Meryl ma'am.
I also got 11.
Well done, everyone.
Well done, everyone.
Well
Yeah,
done,
a song is
everyone.
coming.
Well
A
done,
song
well
is
done,
coming.
everyone.
A
Yes,
song is coming.
song.
Yes ma'am, please.
मैंने प्यार किया
Hey.
मैंने प्यार किया तो डरना क्या superb everyone superb everyone superb well done.
Everyone, thank you, team
Wonderful
Blasters, for such a
performance.
wonderful game.
Thank you everyone for your participation. You all cooperated very well. Thank you. Thank you very much.
Now, anchoring team, you can coordinate the lesson team.
Yes. So our game show and everything is done. Now let's move on to the lesson and we welcome our lesson team, Team Wonders 4. Welcome.
Thank you so
Welcome,
much.
Wonders four.
Welcome.
Thank you, ma'am. So, good morning, one and all. So,
morning.
we completed all our entertainment session, activities, games, and everything. Now it's time for our learning activity. So, as we all know, we are going through our child psychology theory, our third theory, and our first unit of this theory was related to the topic prenatal development. In that topic, we discussed about different stages, then the importance of that prenatal stage and everything. We discussed everything, but some doubts are still in us. No, an expert only can clarify that. So it's better to ask to an expert to clarify all these things. So we have an expert with us to clarify everything. And for our new mothers, we have a new mother going to be mothers here in our class. So for them also, they have some doubts regarding that situation, that pregnancy situation and all. So for them also, and also for us, for everyone, to clarify everything, our doubts and all, it is very good to have this guest class. So for clearing all this and all, we have an expert with us, our Dr. KAVITHA V. SHENOY. She is a famous gynecologist working in Vijaya Hospital in Chennai, and she's a postgraduate in OBG. And as I already said, she is now working as a gynecologist in Vijaya Hospital. And it's our privilege to get Dr. Kavitha, Dr. Kavitha SHENOY as our chief guest. So let's welcome. Now let's hear from Dr.
Welcome,
Kavitha.
Kavitha ma'am. Welcome.
Welcome, Kavitha ma'am.
Welcome.
Welcome, Dr. Kavitha. Welcome.
Welcome.
Thank you so much. I hope you can hear me.
Yes,
Yeah.
ma'am.
Yes, ma'am.
Yes, ma'am, you're audible.
We can.
Yes,
Okay.
ma'am. Good morning, ma'am. And my name is Sana. I am the faculty of this batch, and happy to see you here.
Thank you for inviting me for the session.
Yes, ma'am.
I hope I don't need a self-introduction. I'm one of your colleagues, sister only.
Yes, our
Myself, Dr.
Savita
Kavitha
ma'am.
SHENOY.
Yes.
I'm currently doing my post-graduation in OBG second year in Vijaya Hospital, Chennai. Okay, today we'll be dealing about what all things to be taken care in pregnancy. I hope everyone of us will have doubts during pregnancy, what not to do, what to do. So any doubts, you can clear it at the end of the session. You can write it up in a paper and keep, and at the end of the session, we can have a Q&A session. Is it okay, ma'am?
Yes, ma'am. Can you please keep your mic near to your mouth? The sound is too feeble.
Is it okay now?
Now it's okay, better. Yes.
Okay. As you all know, pregnancy is divided into 3 trimesters. Tri means divided into 3 sections. In the first trimester, it is up to 3 months of pregnancy. That is up to 13 weeks of pregnancy. Hello, you're audible, right?
Yes, ma'am.
Yes, ma'am. It's clear.
Okay. So once a female is pregnant, you have to be very careful about your health, because it can affect your health as well as your baby's health. It can be affected directly or indirectly. So how to calculate period of pregnancy? Period of pregnancy calculated by counting from the last day of your the first day of your last menstrual cycle. That is, if you got your periods lastly on September 10th, and from the 10th we'll be counting the pregnancy, period of pregnancy. Okay. So generally people say pregnancy is so risky, and that too in the first 3 months it is so risky. So it is risky in the way that if you don't take care, it will be risky, and it is not so risky as to cause miscarriages and all. So we'll be dealing with what all to do and what all not to do in the first trimester of pregnancy. So coming to the first trimester, you should not have any unprescribed medical drugs. That is, without any prescription, you should not have any drugs. That is, medicines. You should not take any medicines, and your dietary habits should be changed. And if you are having any uncontrolled medical conditions like diabetes, hypertension, and any other risk factor which can cause directly or indirectly a harm to the pregnancy should be taken care of. So as soon as you are confirmed with your pregnancy, that is, if you miss your period and you have done a urine pregnancy test and it shows 2 lines in your pregnancy test, consult your gynecologist as soon as possible. So the gynecologist will be examining you, will be taking a detailed history, will be seeing an internal examination, and will also suggest some blood investigations, and scan will be there. Okay. So what all to be done? So as soon as a pregnancy test is positive, visit a doctor. So what a doctor, after examination and after scans, he or she will be suggesting folic acid. Folic acid tablet is should be taken in a dose of 5 milligram per day. Daily you have to take folic acid for the first 3 months. It is important for the development of the baby's brain and baby's organs, everything development. Folic acid is required, and it will prevent birth defects. The next thing is chronic medical conditions like diabetes, hypertension, thyroid diseases should be taken care of. And if any changes to be done in the prescription or medication which you were taking regularly should be taken care of. And coming to the dietary things or lifestyle modifications, what all to be done in the pregnancy is, if you're smoking, you should completely avoid smoking. And if any intake of alcohol, you should completely avoid the intake of alcohol, as alcohol intake can lead to fetal alcohol syndrome,
which can cause defects in the baby. The next thing is you should not use any recreational drugs like this some people kanja like that things and all you should not take. Some people not in like it's not so common in South India, but it is common in northern part of the India. Like this recreational drugs, females are also used to. Then radiation exposure should be completely avoided. So once you're having a missed periods also, if you're going for any other checkup, like if you're having cough or if you're having any other like X-ray checkups, just speak with the sonologist and say that you're like having a missed periods or you're confirmed with the pregnancy so that radiation exposure can be limited in pregnancy. Then some people will be asking like, can we take coffee during pregnancy? So caffeine intake can mostly be limited to around 200 milligram per day. That is actually you can take around 2 small cups of coffee. And caffeine is also been included. Like a small amount of caffeine is also there in black tea, black coffee, health drinks which you get bottle health drinks and all contains caffeine. So uh, try to avoid if you're not if you're so coffee addict, you can have 2 small cup of coffee. Then in pregnancy, like truly in every trimester of pregnancy, you should completely avoid self medications. That is, without any advice from a doctor or a trained doctor, you should not conceive any drug, even if it is Ayurveda drugs, even if it is Siddha or like homeopathic medication. You should like ask your doctor and then only continue the medications. Then coming on to the pets, some people will be having cats in their home, dogs in their home. So how to like handle dogs or pets during pregnancy? So the litter of the pets should be taken care of. Like after putting a glove, you should remove, or if anyone is there, like extra person to take care of, let them take care of. In pregnancy, like kindly avoid pets because there is a serious condition known as toxoplasmosis, which can affect the baby's development. Then coming on to the food habits, there is no dietary restriction. Like these fruits you cannot have. Like we may have heard like papaya and pineapple causing abortions. That is a really a myth, but everything is in excess. Like any like any food ingredient in excess will cause harm to the baby and to the mother. So what you can do is like everything should be limited, but in a safe amount. You can have. So any food items you can have, any kind of vegetables you can have, and any type of fruits you can have. But generally, like talking in pregnancy, avoid sugars. Like every pregnant women are prone to get diabetes in pregnancy because the pregnancy is a diabetogenic state. So what to do is like avoid pure sugars, avoid chocolates, avoid ice creams, pure like sugar. Like you can limit it to like minimum, whatever minimum you can do, you can limit your sugars. So what you can do is like if you're eating non-vegetarian food also, you should cook the meat properly before eating. Whatever meat you can have, like beef you can have mutton, you can have chicken, egg, everything you can have, but properly cooked food should be taken during pregnancy. And coming on to the vegetables and fruits, you should like clean it very well before having it in pregnancy. Not only during pregnancy, but in any other like normal people also should consume it like freshly only and after food cleaning. Then coming on to the problems which we face during the first trimester of pregnancy. So most of us will be like familiar with nausea and vomiting of pregnancy. Every like mostly whoever has gone through pregnancy will have had nausea or vomiting during pregnancy. So it is a common complaint which a pregnant lady has during the first trimester. It is due to a hormone which is released during pregnancy known as beta HCG. So nausea and vomiting is common. So if it is like in excess, it can cause dehydration and acid formation in the body, which can directly or indirectly affect your baby and your health too. So what to do if you're having excess nausea and vomiting? If nausea and vomiting is in excess, you can consult your doctor and they'll be prescribing some medication which will be helpful in reducing your nausea and vomiting during pregnancy. If you're not able to eat anything, like not able to tolerate fluid also, you should go and consult your doctor at the hospital and it may require admission. And now and the excess nausea and vomiting in pregnancy is known as hyperemesis gravidarum, and it can be controlled in medications also. If it is like if you are going too early, it can be controlled in medications. Now coming on to constipation during pregnancy, the first trimester, as I said, like the beta HCG hormone also causes now this constipation in pregnancy. It is absolutely okay to have constipation. What to do is like you can have plenty of water, like around 3 liter per day is the minimum like quantity which you can have during pregnancy. So you can have a big 3 bottles filled up in the morning and like have it throughout the day. Next thing is the pregnancy. You'll have breast changes. Your breast will be feeling engorged and you'll have pain in the first trimester in the breast. So nothing to be done for that. It is all due to these hormonal changes. Once the 3 months is like over, like you are entered into a second trimester, these symptoms, everything will be coming down. Then the frequent complaint which we get in the first trimester is loss of weight. Because of this nausea and vomiting, nobody will be able to tolerate food items or even fluid. So what, like every female will have a limited amount of weight loss during the first trimester. So it is absolutely okay to have a weight loss. But if it is in excess, like around 10 kilogram you lost in this nausea and vomiting, you should as an emergency, you should consult your doctor. Then as common for everyone, you should avoid oily spicy food and frequent small food items you should have, like without having a 3 idli in the morning breakfast, you can split it up into like 2 idli in the morning around 8 o'clock, then one idli at around 10 o'clock. Like that you should split up your meals into 3 large meals and 3 small snack meals. Okay, like around 8 o'clock you can have 10 o'clock, then afternoon like you should have the dinner, afternoon you should have the lunch at around 1 o'clock, and you have a like light meal like snack at around 4 o'clock with your tea. Then you can have your dinner at around 7 o'clock, and before like sleeping you can have a glass of milk and 2 biscuits. Like that you can split up your diet, but like a large quantity of meals should not be taken each time when you are having it. Then coming on like when to visit a doctor in the first trimester. If you're having bleeding or spotting for vagina in the first trimester, you should visit your doctor. And as I discussed, if you're having hyperemesis gravidarum, that is excess of nausea and vomiting during your first trimester, you should go and consult your doctor. And if anything abnormal you are feeling with your health, you should go and consult your doctor. Now, tiredness, sleepiness, everything is common in pregnancy first trimester. What you can do is like be active, do exercises, limited exercises like stretching exercises, yoga, walking, everything can be done. No restrictions as such as to a pregnancy, which is low risk. But some people will suggest like if you are having an IVF conception or an infertility treated pregnancy, what you can do is like limited exercises you can do, like stretching exercises, and like heavy weight like lifting and all can be avoided. And it is as such as like it's not proven that it will cause abortion, but you can prevent it in like infertility treated patients or like high risk patients and all can be treated like this. Then coming on. So the medications mainly will be folic acid during the first trimester, and number of scans during the first trimester will be mostly 2 scans. The first one is known as the dating scan, which is around done at around 8 weeks. It is around 2 months. It will be done. It is to confirm that your pregnancy is intrauterine. That is, the pregnancy is inside the uterus or it is outside the uterus. If it is outside the uterus, it is known as ectopic pregnancy. So, like ectopic pregnancy should be managed immediately as an emergency. It is a like drastic emergency should be treated as soon as possible. So, if you are having a missed period with vaginal discharge and lower abdominal pain, consult your doctor immediately. And the next scan will be around 13 to like 11 to 13 weeks. It is known as the NT scan, which will measure the baby's nasal bone, and it will be a predictor of the baby's growth throughout. And it will be combined with a test known as double marker test, which is done around 11 to 14 weeks, and it is combined with your first NT scan. And they'll give a value that if you're having a probability to have a baby with Down syndrome or any trisomies like trisomy 13, 18, and 21. Then coming on, you will not having any you will not be having any immunization during the first trimester. So mostly like to be taken care of is the nausea and vomiting of pregnancy in the first 3 months of pregnancy. I hope everyone is audible, right?
Yes, ma'am, we are listening. Now we are getting a correct idea how the pregnancy is starting.
Yes.
Yes, we are listening here.
Like no response from your side. I am only speaking.
No. Actually, we are getting so many doubts. So we are waiting for you to end first.
We are noting it down, ma'am.
Yes,
Okay,
ma'am.
okay. The next thing is everyone will be asking, can we have sex during the first 3 months of pregnancy? It's absolutely okay to have sex during the first 3 trimesters. And like as such as if you have a sex, you will not lose your baby because of abortion. If your baby is strong enough to be like carried up to your term, it will not be like aborted. So you can have it as safe to have sex during the first 3 trimesters of pregnancy. And now moving on to the second trimester. Second trimester of the pregnancy is from 14 weeks of pregnancy up to 27 weeks. Till the last 27, like around, it will be around from 3 months to 7 months of pregnancy. So it is a golden period of pregnancy, and it's known as the honeymoon period of pregnancy. So why it is known as like it is called as a honeymoon period? Because in first trimester everyone will be feeling nausea, vomiting, tiredness, they'll be feeling so sleepy, they'll be feeling so like tired to like you I'm so much tired that I cannot do my daily things. So these symptoms everything will be subsided by around second trimester, that is around 3 months. Complete, it will be like completely weaned off. So everyone will be enjoying their period during this second trimester. So what all things like from the first trimester, what all things is change in the second trimester we'll be dealing with. So first trimester, at the end of around 13 weeks, your baby will be around 50 grams, and it will be around 5 inches length in the first trimester. And at the end of second trimester, your baby will be gaining about 1 kilogram of weight around and 5 inches of in length. So what all to be taken care of? Your baby, like this is the time where your baby development has happened, like, and 20 weeks is the time where major organs start functioning, like heart, lungs, eyes, ears. Like your baby will be able to see, but by around 18 weeks your baby will be able to hear by around, will be like most of us will have heard that Raja Ravi Verma used to hear that lullaby. So it is like your development will be starting around 20 weeks. Whatever you speak, your baby can be here, like baby will be hearing. So like be in the contact with your baby. When you speak, you will be feeling some peculiar movements in your abdomen, tummy, like butterfly movements you'll get. That is like mother's voice, baby will be like responding so much. Then coming to the kicks, mostly the symptom which will come through in the second trimester is we'll be feeling fetal movements. In a first pregnancy, you will be feeling it some more late, around the last of the fifth month, around 20 weeks, you'll be feeling baby movements. But if it is a second pregnancy, you will be feeling the movements some more earlier, that is around 18 weeks, that is around 4 to like 4.5 months, you will be feeling the baby movements. It will not be as such as so much like big kicks, it will be like small butterfly movements. So once you have come through one pregnancy, and if you are in the second pregnancy, you'll be feeling it much more earlier, because you'll be having one like already having one history of knowing this moment, so you will be like feeling it some more earlier. Then coming on to the changes during the second trimester of pregnancy, then weight gain is common, and it is okay to have a weight gain around 2 to 2.5 kilogram per month in the second trimester. And uh, and whatever weight you have lost in your first trimester due to nausea and vomiting will be covered up in the second trimester. Now coming on to the breast changes, your breast will be bigger, and it will be like swollen, tender it will be. Then there will be some discharge from the nipples. It is absolutely okay to have breast changes, and there will be like darkening of the skin of your breast, and all body parts like skin of the face, legs, abdomen, tummy, and everywhere you will be having dark spots during pregnancy. And it is due to the hormonal changes in pregnancy, and no treatment as such for the color changes during the pregnancy. It will be once your pregnancy like is terminated. Then coming on to the stretch marks. Stretch marks in pregnancy is also due to the baby growing inside. It will be stretching your skin, so that at one part of the time it will be like giving up to the baby's size. So you'll be feeling stretch marks, and it is not due to scratching. Some people used to say, if I scratch, will we get a scratch like stretch marks? It's absolutely
Yes,
no.
yes, yeah.
It's because of your baby's growth. It depends on some people's skin tone also. Some people even will not have any stretch marks, you'll be feeling so tense abdomen. Some people will be having excessive of stretch marks. It depends upon each person. Like if a person is having like tight skin, and the baby is growing, so like I told no, around 1 kilogram the baby will be having around last of second trimester. So because of this baby's growth also, the stretch marks will be so much evident in some people. So it's absolutely okay to have no stretch marks and absolutely okay to have stretch marks. And you will be feeling some more itchiness when you have stretch marks. It's absolutely due to the skin breakage, nothing else, like because of your scratching or nothing like that, you will have these stretch marks. Then coming on to one dark line you'll be seeing if you like have been had a pregnancy, you will have seen one line extending from your like bikini line towards like umbilicus. You'll be seeing one black line. It is
Yeah,
known as
like a corrective portion, no, dividing our
yeah.
stomach.
Like small hairs, no ma'am?
Yes.
Yeah,
Yes,
small
correct.
hairs.
It will be line.
Yeah.
Yeah, like correctly one line will be there. It is known as linea nigra. It is like a mark. Let us pregnancy, like due to the hormonal changes only it is happening, but it will settle down once your pregnancy goes off. And you will have other black marks surrounding in your abdomen, in your legs, upper part of your legs, and inner part of your thighs. It will be darkened. It is like okay only to have that. It is normal during pregnancy, and it is not a like a disease which has to be treated by a dermatologist. Then coming on, uh, some people will be having nasal stuffiness and bleeding in the pregnancy. It is okay to have. What you can do is like vaporization. You can have. You can use nasal drops. Even if it is not subsiding with nasal drops, you can go and consult your gynecologist. It is okay to have a dental checkup during a second trimester because dental hygiene is also an important part in pregnancy. If you are having any dental pain, most of us, like most of the pregnant ladies, might have at least once they might have had a toothache. So it is okay to have that. But if any infection is there, it can cause preterm labor. So it should be treated on time. And you should brush your teeth after your meal. Like we used to teach our like children, right? You should brush your teeth before your food and after your meal. Like that, you should like in pregnancy also it is required to have a good dental hygiene. Now coming on to the leg cramps, pregnant in pregnancy you may get leg cramps mostly during the evening time. Before you go to sleep, you will be feeling leg cramps because you're active throughout the day in the morning, and you will be feeling so tired. And that time you'll be having this leg cramps. It's absolutely okay. What you can do is like you can apply any painkillers, and you can do hot fomentation for your legs, and magnesium tablets also you can have during pregnancy, but after medical advice only. Then coming to piles or hemorrhoids, uh, everyone in pregnancy during around second trimester or third trimester, you may have had piles, and it may have blood also, like bleeding during going to washroom. It like some of you might have encountered this situation. So it is mostly commonly due to constipation of pregnancy. So one thing to be avoided is constipation. Then have plenty of water. Then one thing which you can everyone can do at home is like take a large basin, put some betadine solution in some like lukewarm water, and you can sit in that water for around half an hour. If you can be you can do it in around morning time and night time. And but if it starts bleeding or if it is not treated by like this, you can go and meet your gynecologist. Then backache is a common problem in pregnancy, and it cannot be treated by orthopedicians. It has to be you should be active in your daily life. You should do exercises. Then if you are using high heeled shoes and all, you should high heel sandals and all. You can just change it to flat heel or shoes you can use, and it will be it should be correctly fitting your legs. Then as I said, you should have hot you can have hot fomentation in your back and all to reduce this back pain. Then the next common complaint in second trimester is vaginal discharge. That is, you may have white discharge during pregnancy. It is okay to have white discharge during pregnancy unless it is foul smelling or any color changes there, like green color or tinged with blood, that is reddish color, or like any curdy white, it'll be like curd. If you're having such vaginal discharge, or if it is so unpleasant, you should come and meet a doctor, because if any infection is there in your lower genital part, it can cross the baby's uterus, and it can affect the baby also. Or if it is untreated, your baby is anyway, if you're going to have a normal delivery, the baby is going to come through that passage, so your baby also may get this infection. You can have preterm labor also. So it is it's an emergency, you should be get treated for that vaginal discharge. Then coming to urinary tract infection, urinary tract infection is also a common problem which pregnancy it is there. In pregnancy, mostly it will be asymptomatic bacteriuria. Asymptomatic means you will not have any symptoms. That is, you will not have any pain during urination. You will not have any abdominal pain. Mostly the doctors only will be like knowing in every trimester we'll be asking you to do a urine routine test. So in that you will be having this white discharge, not white discharge, infection. So it should be treated on time, or else, like as I said, any infection anywhere in the body can cause preterm labor. So any infection should be treated as soon as possible. Um, then coming on, like as I told, you will be advised to do urine routine test in every trimester or in every visit when you go to a doctor. So what you have to do is, like, if you are having any white discharge, like normal white discharge also, before giving for a urine test, you should go to your washroom, clean your private area, like in your vaginal area very nicely. Then with a tissue paper, dry tissue paper, you should mop off your perineal area. Then only you should catch your urine sample and give, and that too a midstream urine, not the first flow of urine. During the middle part of the urine, stream of urine, you should collect your urine test and give, or else you will be getting a false positive. That is, they'll treat you for your urinary infection, but actually you may be having only white discharge. Then coming on to like when to go to a doctor, like when all they'll call you for a checkup. In second trimester, mostly doctors will call you only once in 4 weeks. That is for like one visit every month. Okay, and they will examine you. They'll be checking your BP, weight, and if the weight gain is adequate. And you should not have a weight gain of more than 2.5 per month. Like in each month, you should not have a weight gain of more than 2.5. So if it is more than 2.5, you will be requiring extra tests to check for like if you are having any blood pressure, if you are having any edema in your legs, they will be checking. Then mostly two scans will be there in second trimester. That is, one is anomaly scan, which will be around your 5th month of pregnancy. Like it is a major scan. In throughout your pregnancy, if you ask me which scan is the important one, or only one scan if you have to do in your pregnancy, that will be your anomaly scan. Because in this anomaly scan, your baby parts will be checked for, like heart will be checked for, like if there is any murmur, if there is any valve problem, or if there is any lung issues, if there is any kidney issues, if there is any growth issues, everything will be checked throughout in this 5th month only. So if any abnormality, like anomalies in the baby, if baby is not having one kidney, or if baby is having any other kidney problem, if baby is having any brain problem, the brain development, if there is any structural abnormality in your baby, can be detected by around 5th month of pregnancy. So if you encounter any anomaly in the baby, and if you are not willing to continue your pregnancy, it can be terminated. Uh, Now the termination, as per the Medical Termination of Pregnancy Act, the termination of pregnancy is extended up to 24 weeks. So like if you're having an anomalous baby, and you and your partner is not willing to continue the pregnancy, you can just consult your doctor and request for termination of pregnancy also. So this is the major scan which is needed in pregnancy. The next scan will be around 28 weeks. That is last of the second trimester. That is to check for baby's growth, like how much weight your baby is having now, and what is the position of the baby, like the baby is head down or head up, or baby is lying longitudinally, transversely. This and all can be checked in the scan. But the scan is like as such, like this position is not at all like correctly. It can change because baby will be crawling out in your abdomen. In that fluid, baby will be crawling. So this scan is not like 100% accurate to diagnose your position. And we'll be confirming the position only by around 36 weeks. That is around 9 months. Then the blood test which you'll be having in your second trimester will be one glucose test to detect gestational diabetes mellitus. As I already discussed in the first part of the pregnancy, first trimester, if you are a high risk patient, like if you are already having a diabetes before your pregnancy, or if you are prone to have diabetes in your pregnancy, like if you are both, if like a pregnant lady's mother and father is diabetic, or any one of your parents is diabetic, there is a chance of diabetes in pregnancy. and as its pregnancy is also a diabetogenic state. So we should check for diabetes, or if a lady is obese or she's having any other comorbidities, she may have a chance of getting diabetes in her pregnancy. So it should be checked for and treated, because if you leave as such this test, if you're not doing, your baby will have birth defects if you're having diabetes like before pregnancy. And in pregnancy, if sugars is not maintained, there can be complications which you will encounter during your pregnancy. So around 24 weeks, that is around 6 weeks, you'll be having one test that some of you might have done. You will be having a like blood test which you will do in fasting. Then one glass of sugar they'll give. Then you will one water they'll be giving. You'll have to drink. Then after 1 hour and 2 hours, they'll be asking you to check your values. So once you check your values, and if it is elevated, they may ask for an endocrinologist opinion, or they may like treat like as such as for gestational diabetes mellitus. So if you are confirmed with gestational diabetes mellitus, you should be treated accordingly. You should be having a strict diabetic diet, and like if they are adding on with some medications for diabetes, you should take it regularly, and you should check your sugars regularly. If you are having like uncontrolled sugar, that can also cause harm to the baby. Then coming on to the vaccination. Mostly you will get your vaccination shots in the second trimester of pregnancy. Everyone might have got like TT injections during your childhood. Up to like 16 years of age, you might have got TT injection. As like that only you will have vaccinations during pregnancy. And in the first vaccination will be TT or DT, that is tetanus toxoid or diphtheria plus tetanus toxoid. Now it has been changed. Mostly every institution now prefer diphtheria and tetanus like more than TT alone. So diphtheria and tetanus vaccine will be taken around 6th month of pregnancy. That is around your anomaly scan. After anomaly scan, they'll be suggesting you to do this tetanus vaccination. And your second vaccine, the second shot of your vaccine will be around 28 weeks of pregnancy. That is around the 7th month, you will have your second vaccine. And the second vaccine is a component of three vaccines. That is diphtheria, tetanus, and acellular pertussis. That is three components will be there. So your baby will be prevented from these three diseases. Then if some of like the pregnant ladies will be asthmatic or some respiratory problem they may have, and they can like encounter flu infection. We might have heard influenza, pakshipani. So if some like if they are prone to have a bronchial asthma in pregnancy, they will get a flu vaccine also. And now we all are going through a bad situation with COVID-19. So every pregnancy, we recommend every pregnant woman to get vaccinated against COVID-19. You can take Covishield, Covaxin during your pregnancy also. There is no, as such, no like harm to take COVID vaccine during your second trimester. And once in second trimester, the folic acid tablet which you were taking in your first trimester, that is 5 mg tablet you were taking, it will be changed to iron, calcium, and like some doctors will prefer to take folic acid with DHA content during your second trimester. So mostly this will be the medication which you will be like taking during your second trimester. Then coming on to the third trimester. That is third trimester is a very important part of the pregnancy, and every other people, not only the pregnant woman, her family members also will be looking through this part of the pregnancy. So third trimester will be after your 28 weeks. That is after your 7th month of pregnancy. You will be like entering your third month, like third trimester of pregnancy, and it will be lasting up to 40 weeks of pregnancy. And pregnancy is totally duration of 40 weeks. But some people may deliver before 40 weeks. It's absolutely okay to deliver by around 7th, 8th, or your 9th month of pregnancy. So up to when you deliver is your third trimester. So in third trimester, like the baby will be growing, and around last, as I discussed, around last of your second trimester, your baby will be around 1 kilogram of weight, and your baby will be gaining weight of around 100 grams per day, and your baby will be baby weight will be around 2.5 to 3.5 kilogram by the end of your third trimester. By the time of delivery, your baby should be having more than 2.5 grams, it's 5 kilograms. Then as I suggest, like as I said, discussed with you earlier, you will be having one term scan at this time of your pregnancy, that is in the third trimester, which is to look for your baby's position. baby's weight and the fluid level around the baby and the blood supply to the baby, everything will be looked through in the scan. So if you are having a baby with head in, like head is down, you can go through a normal delivery. If your baby's head is up, you can try, like the doctor will suggest you to try some manuals, like to turn the baby the head down position, and if it is not successful, they may like ask you to go for a elective cesarean section. So this and all will be decided in your third trimester. So now coming to the symptoms which you encounter during your third trimester. In your third trimester, around the last part of your third trimester, some people will be like, in the first part you will be feeling breathlessness, breathing difficulty. While sleeping, you will be having gastric like symptoms. You will be having heartburns. This and all are common during pregnancy, and it is due to the baby growing and pushing your diaphragm up. So it is common to have that. But at one time of pregnancy, you will be feeling some lightened feeling. You'll be like you'll be feeling your upper tummy to be some more lightened. It is because your baby's head is going into the pelvis to like to go into labor. Okay. The next thing is, some people may have light tightening of your abdomen. It is absolutely okay, and it is known as Braxton Hicks contraction. And this tightness will not be in, like you may not, some people may not even feel this Braxton Hicks contraction. It will be like light tightening and will go off, and it will not be regular, and it will be so much erratic that only the doctor or like physician or sisters, nurses will be able to notice that. Excuse me. So it's absolutely okay. But if you're having severe pain and intermittent pain with increasing in frequency, you should consult your doctor as soon as possible. The next thing is bleeding in pregnancy in the third trimester. Bleeding is not like, it's not okay to have bleeding in your third trimester. So if you encounter with like fresh bleeding or like any formed bleeding also, you should go and consult your doctor, because it like bleeding can happen because if there is any placental problems, that if your placenta is low lying on the cervical os, it can bleed. Or if any problem to the like your cervix, that is mouth of the uterus, if there is any problem also, you can bleed. So if you're having bleeding, it is an like emergency. You should go, like don't call your doctor and ask, can I come to the hospital? You should as an emergency, you should go to the hospital. Now the next thing is, you can have watery discharge, vaginal discharge during the third trimester. If it is so light, watery, like or urine like discharge, it like it is a sign that your baby's membranes have broken. So what you have to do is, like you can uh, get ready, pack your bags and go to the hospital, and you'll be going through the labor. Next thing is, the most important thing to be taken care in the third trimester. Every doctor, like everyone, will suggest you to check for baby movements. Baby movements is a good sign that your baby is healthy inside. So we'll be suggesting you to check for baby movements in 2 hours a day. Like any part of the day, it can be checked, but after a good meal, that is mostly in Indian population, we'll be having a good meal at afternoon lunch. We'll be having rice with some curries and all. It'll be a heavy meal for us. So it is most preferably, we'll be asking you to count your baby movements 2 hours, 2 hours for 2 hours after your lunch. So like what you have to do is, like have a good meal, rest for around 10 to 30 minutes. Then you can lie on your left side of your body. Then you can like start counting your movements. Sometimes it will be small, mild movements. Sometimes it will be kicks. So everything you have to count in 2 hours. If you are getting 10 movements, it is absolutely okay. But and like daily after counting, you will be knowing how your baby is moving. This is the pattern how it moves. So if there is any abnormal pattern, like if the baby movement is in excess, or if it is less than 10 in 2 hours, report immediately to your hospital. So like the gynecologist will be taking a graph for the baby graph, baby's ECG. Like this is the common things people used to say. So if it is okay, the baby doctor may suggest the blood supply test also for the baby, the scan also they will be suggesting. So this also should be done if you are having decreased or increased or abnormal fetal movement pattern. The next thing is, you may feel increased frequency of urination during this third trimester. It is because the growing pregnancy will push on your bladder, so that you will be feeling like to to go to washroom frequently. It is okay to have that, and no treatment is needed unless you are having pain or lower abdominal pain or fever during this urination time. Then people like pregnant people will be having varicose vein all over their legs. It is due to that pressure of the baby, that is around 2 to 3 kilogram baby is pushing down into the pelvis, so that the blood supply will not there will be no proper venous drainage in your lower limb. So it is okay to have varicose veins, but if it is in excess, if you are having so much of pain, you should consult your doctor. Then swelling of legs is common during pregnancy. It is due to prolonged standing. Some people will be like they'll be managing their home single, like as a single person, they'll be managing. Like they'll always be there. So from morning they'll be sweeping the home, cooking food, everything they'll be handling singly. So by around evening time, you'll be feeling like swollen legs. It is okay, it is physiological. But if you are having swelling legs without even if you are taking rest and if you are having swelling in your legs, you should immediately consult your doctor. Then coming on to the breast changes, as like we told in the second trimester, breast will be engorged. That nipple, the black area in your breast will be some more engorged, and you may have nipple discharge. So what you have to do is like if you're having breast heaviness, don't squeeze and see if to see if your milk is there. But once the secretion has started in your breast, it will be like going on. So if you're not feeding your baby, it'll be like you'll have fever and infection in your breast. So what you have to do is like from the second trimester, so throughout the pregnancy, you have to buy an extra like size bra for like which should be fitting your breast. It should not be so tight. It should be like perfectly fitting and supporting your breast, so that this heaviness symptoms everything will be reduced. Then the first some like discharge type will be there from the breast. It is known as colostrum. That is yellowish color, milkish, like some oily type discharge will be there. It is okay to have that. It is a colostrum. It is a baby's first feed. Then throughout your third trimester, doctors will call you for the up to 36 weeks. You will be called once in 2 weeks. That is every 2 weeks you will have to meet your doctor. Then once after 36 weeks, you will have to go for weekly visit to your doctor. The doctor will be examining you by around 36 to 38 weeks. Doctor will be doing an internal examination and will be saying, okay, you can go through a normal delivery. That is the pelvic assessment they'll do. That is if the baby is okay to come through your vaginal pathway. That if there is any obstruction, they can like around a 50% they can detect it during your before your delivery itself. They can say like your baby, it will be difficult for your baby to come through that way. So you will be like posted for elective cesarean section. If it is like okay, they'll assess and say according to your pelvis, they'll suggest what the next plan is to be. Then what all things to be like when to report to a hospital during pregnancy. If you're having pain during like pain that is increasing in frequency, so once if you're a second, if you're in a second pregnancy, you may know that in first pregnancy I had this type of pain, so I have to go to a doctor. But the persons who are pregnant for the first time may not know what is pregnancy pain, what is labor pain. They may be confused. For small pain, they'll think it is a labor pain and go to the hospital. So a labor pain, if it has started, it will not stop. It will be like increasing in frequency. If you're having like in a 1 hour time, 1 hour like gap, if you're taking, if you're having one pain for 1 hour, for the next 1 hour, it may not be one pain. It will be like increasing in frequency. You may get 2 pains, 3 pains, and it will be increasing in duration and increasing frequency. You will be feeling around 10-second pains like in the earlier part, then it will be around 30 seconds and 40 to 45 seconds during up like nearing your labor, and most of the people will not be able to tolerate that pain. So if you are having pain which is increased in frequency, severity, or back pain also, you have to go and consult your doctor in the third trimester. And coming on to, like as I already discussed, if any bleeding per vaginum, leaking per vaginum, or any discharge per vaginum, that is if you're having watery discharge, if you're having bleeding, you have to go and go to the labor room immediately. Then coming on to nausea and vomiting in pregnancy in the third trimester, if you're having headache, giddiness, tiredness, or increased or decreased fetal movement, you should go to your doctor immediately. Then if you're having any pain during passing urine, or if any lower abdominal pain, any abnormal vaginal discharge, you should go to your doctor immediately. So throughout your pregnancy, you should be actually stress free, because then only you will be able to enjoy each and every moment of your pregnancy. And everyone, like not only you, every like people around you should be also supporting. So what you have to do is like create a good environment around you, like your husband, if you are having a supportive husband, like discuss every problem which you are having or which you are going through in your pregnancy. Some people may not have like a friendly husband to speak up with. So what you can do is like make a group among yourself, like you are having a good group. I saw like the discussion prior, which I already joined around 10:45. It was a lively session which I was watching through. So if you're having a good group of friends to like talk with or discuss your problems with, that will be more than enough to have like during your pregnancy. You should have a stress free, as I already discussed, you should have a stress free period during pregnancy. You should not think of unnecessary things. Will my labor pains be so severe? Can I like, will I be able to go through my like normal delivery or cesarean? How to take care of my like newborn baby? How to breastfeed my baby? This all may be a concerning problem during your pregnancy. Don't like think of the things which will be happening after delivery. You should be like prepared for a normal delivery. If you're not feeling like emotionally, if you're not feeling good, we might have heard like news like a pregnant, like after delivery the mother itself killed her baby. So these are like that hormonal changes which will like affect the mother's health. And if there is no, if there is uh, if she is not having a help around, or if she is not having a supportive group around, she'll like go through, she'll have suicidal attempts, she'll have like the sense like feeling to kill her own baby. So what you have to do is like you can get through into a supportive group, or delivery classes and all will be there. In some part of India, there is classes which will help you to like go through your pregnancy and all advices, medical advices they will give. So you can join such classes and interact with your friends, so that your pregnancy time will be so much enjoyable. So this is the small class which I prepared in around 1 hour time. I hope everyone like understood what I have like discussed with you. If you are having any doubt, you can ask.
Yes, ma'am. Kavitha, ma'am, it was a truly nice session. That word that we want
Yes,
to
ma'am.
discuss.
Thank you. Superb, ma'am.
Yes,
Thank you
thank
so
you,
much.
ma'am.
Thank you so much, Dr. Kavitha, ma'am.
Thank you,
Yes,
ma'am.
ma'am.
Thank you.
Ma'am,
Thank you
can I
so
ask
much.
something?
I
Like
know, I know.
we used to give, at the 5th month, if we are having if we got a pregnant again, like within a 6 month and all, the second pregnancy started. Do we need to repeat this?
I didn't get your
Ma'am, at
question.
5th month, we are taking some vaccination, no? At
Yeah,
second trimester. If we get
yeah,
pregnant second time soon,
yeah.
then again
Okay. Let
do we need to take that vaccination?
take the vaccine. Okay. So the most vaccination which everyone used to take is TT, tetanus toxoid, or diphtheria, tetanus, or as I discussed, the three components: diphtheria, tetanus, and acellular pertussis. So if you're having inter-pregnancy interval of around 3 years, like within 3 years, you can take only one booster injection of TT. That is, if your first child is around 2 years or 1.5 years, if you get pregnant soon, you can take your booster dose only. But if it is
Oh.
more than 3 years, you should take the 2 vaccines.
Yes. Thank you so much, ma'am. Then can you please say about the ovulation and all? How to get pregnant also is very important thing, no?
Okay, like that is a big topic. I'll
No, no, no,
discuss
no.
some.
It's just because we are so many young ladies are there who wish to
Yeah.
become pregnant. So they are not
Okay.
aware about the ovulation period and all. They only know the
Okay.
term. But this period, no, there will be certain day and all that they don't know.
Okay. So what the thing is, the first thing, if you're planning for a pregnancy, you're audible, right?
Yes.
Yes, ma'am.
Okay, so if you are planning for a pregnancy, if you like one girl is getting married, so she can have a pre-conceptional counseling, get a gynecological, like with a gynecological doctor. So gynecologist will be checking her blood test if there is any hormonal changes like thyroid abnormalities, if any prolactin abnormalities, if any like sugar she's having, how is her total like basic health they'll be checking. If you're not going, it's also okay. But if you're like in abroad, like everyone will be having a pre-conceptional counseling, like Christians will be having premarital counseling sessions. Similarly, like everyone can have a premarital or premarital or pre-conceptional counseling sessions with your gynecologist. So what mostly we'll suggest is like this folic acid which you're taking in your first trimester will be helpful if you take it before, like if you're getting married next month, you can take it. And if you're planning for a pregnancy soon, you can start taking your folic acid tablets 5 milligram per day. Daily you can take. It will not cause harm to your baby. It will be like advantages only. And some people will be having seizure disorder, Jenny. So if something is like that, like if there is a history of seizure disorder before your pregnancy, and if you're planning for a baby and the baby can have like because you're having some tablets for this epilepsy, the baby can have some birth defect. So it can also be prevented by taking this folic acid tablet. And some people like we might have heard the baby's brain growth is not so good, like mentally abnormal babies, retarded babies, sorry, mentally retarded babies, or as such to say, some babies like neural tube defect, we'll say baby's brain growth, that brain growth is not good. So in such cases the dose of the folic acid will be increased. And such patients are at risk of having birth defect in the baby, so they should take folic acid. So folic acid is the one thing which we prescribe. The next thing is we'll be advising about the fertile period, when to have sex to have conception. That is, if some people will be having regular cycles and some people will be having irregular cycles. Some people will be getting like regularly 30-day cycle or 28-day cycle. And some people will be having like around once in 2 months only they will get, or once in 3 months. They cannot correctly say when they will get the next periods. So in a lady with a regular cycles, mostly the ovulation occurs on like 14 days before your next cycle. That is, if you are going to get your periods next period on day 28, and if you are having a regular cycles, you just subtract 14 from the 28. That is, you will get around 14. If you are having it around 30-day cycle, 30 minus 14, that is around 16 will be your ovulation day. But correctly it will not be on 16. We cannot predict it will be correctly on 16. So what we'll advise is like 4 days before you should have like intercourse with your partner, and 4 days after this day. That is, if you get the day as 14th day. So 14, around like 10th day you can start intercourse and continue up to day 18th of your cycle. And this is calculated from the first day of your cycle. Okay, so if you are having periods on 10th, so count from 10, 10, 11, 12, like that you count. And from the 10th day, you should have like intercourse with your husband. And frequency will be like once in 2 days you can have like intercourse. Daily intercourse is also okay. And you should continue it up to day 18th of your, like till day 18 of your menstrual cycle. So the life cycle of an ovum, that is an egg, the female egg is around 2 days, maximum of 2 days, and the male sperm is around 3 days. So like a frequency of like intercourse should be once in 2 days. And once you are having like a sexual intercourse, you should lie straight like that, or you can just elevate your like buttocks part a little by keeping a pillow under, so that like sperm can go inside through the cervix and go up to the fallopian tube. But it is not necessary to keep a pillow below, and you should wait around 10 to 15 minutes like that. Some people like after intercourse they'll go straight away to wash their area, private area, and they are not feeling comfortable with the semen like they had during their intercourse. So such like it like if even if you wash also there is a chance of conception only. But some people like so long treatment they'll be taking for infertility, this and all advices will be given to the pregnant ladies to conceive faster. And the next thing is, if the husband is having a night duty or the female is having a night duty, and mostly the night time only they'll be having a good time to have an intercourse. So like if you're planning for a pregnancy, like at least during the fertile period, try to be together. Or before this, like before the 10th day of your cycle, or after the 18th day of cycle, if you're having a sex, there is a less probability of getting conceived than a person with like irregular cycles. That if she's having 30-day, we might, like most of us may have heard a word known as polycystic ovarian syndrome. that is like tiny small follicles in your ovaries.
Yes.
Such ladies will not be having regular cycles. That is normal for them to have an irregular cycle. They'll be getting around cycles around once in 2 months, and once in 3 months they'll be getting. Sometimes they'll be getting 30 days. So nobody can predict when the egg is releasing. Some of them will not have an egg they'll not have an egg release also. Without egg release also they can get cycles. So in such patients, the doctor will suggest follicular monitoring. That is, they'll be have to screen their ovaries to see the egg is growing or not. That is, the follicle is growing or not, and the doctor will be suggesting when to have intercourse, if any other tablets to be taken during the intercourse. This is like the mostly what we have to say when to plan for a pregnancy.
Yes, thank you so much, ma'am. This is so informative, ma'am.
Yes,
Everyone
ma'am.
is going through this PCOD like cyst and all, and nowadays it's common for me to hear that that cyst and all have overgrown, so operation is going on. Like my two, my near this week itself, 2 people got that operation for that cyst removal. So this session is very informative, ma'am, and thank you, Kavitha ma'am, for being here.
Thank you so much. Thank you so much for inviting me from the bottom of my heart. So much thank you. Like, my sister insisted me to come. I was not at all interested, and this is my live session, the first session which I am taking for a group of people. I have not been been so much I have not taken one class or some for children also. I have not
That it
taken.
will be a first experience, but it was nice, ma'am.
Yes,
Because
ma'am,
we
it was
have already
really good.
completed
Thank
one
you so much,
pregnancy,
Kavitha
no?
ma'am.
So we are able to
Thank you
connect
so
it.
much, Kavitha ma'am.
My sister's only yelling from there.
Yes, Kavitha ma'am, you can open your video, ma'am. No, and it was a nice session, ma'am. That pineapple.
Thank you so much.
I am going there. My husband, sister.
Yeah, she's going to her in-laws.
Husband,
in-laws
sister,
place.
Yes,
child
ma'am. Yeah, she
birthday,
told.
ma'am.
She told. No problem, ma'am. Then carry on, Savita, ma'am. So that pineapple and papaya
Thank
we
you
used
so
to hear now.
Yes.
Don't have it. But it's like
That
a,
was a
everyone
traditional myth. It is a traditional myth that was following.
Yeah, everyone used to say so much things like you should not walk speed, you should not do anything. And some people used to say if you can I speak in Malayalam, right?
Yes,
We
ma'am.
used to മാവ് ആട്ടിക്കൊണ്ടിരിക്കുമ്പോൾ ഞാൻ പോയി പ്രസവിച്ചിട്ട് വന്നു. Some people used to
Yes,
say like
ma'am.
that, and
Yes.
it is not absolutely nothing can if you do something you will go into normal delivery, and if you don't do exercises you can end up in a cesarean. Nothing is like that. Mostly normal delivery and cesarean is depending on your how your pelvis is, how your uterus
Yes.
cervix is, how the opening, the dilatation is. And if you're having adequate dilatation also, the baby also should come down, and baby's position should be good, baby's heartbeat should be okay, and mother's heartbeat, everything should be okay. Then only you can go through a normal delivery process.
Okay,
So,
ma'am, can
so
I
many
ask a
things.
question?
Yeah, sure.
Okay. Yes, ma'am. In my pregnancy time, what I had was in the last PV section, the doctor told me that I was not dilated properly, and it will be really hard for me to have a normal delivery. So what she suggested.
Wait for your friends, okay, Nia? Yes, ma'am. Yes, continue.
Yes, ma'am. So what happened was she suggested me to go for that tube. No, that tube will be inserted for the dilation.
Yeah.
So it was like that. So ma'am, I want to ask is there any exercises or anything like that to do for the dilation of our pelvis area?
Nothing, no exercises as such for that. Some people used to say if you walk, that area will be some more relaxed. You'll be able to spread up your legs to have the baby that way. That is the only thing I think of. If you don't have exercise, if you don't do exercises also, you can have a normal delivery. No specific exercises to promote a normal
Example is
delivery is
me.
there.
Then no exercise, so we will have a normal delivery. No, I used to dance a little bit later. That last
Like
trimester.
that truly depends
Climbing
upon
and
the
all, no, that climbing the stairs, walking, exercising, that mopping, rubbing, everything we used to do at that time, no? Yes,
this is
that's the
just to like keep yourself fit, yourself active, that you won't gain so much of weight in your pregnancy. You should have a good time during a pregnancy, that is you don't develop diabetes, you don't develop hypertension during pregnancy. So we suggest so much exercises and to keep yourself fit. This is like this is a major aim that we suggest you to do exercises, not to like to have a normal delivery. And so many people will be having the bikini area pain during pregnancy, third month, second month, third month. You'll be having cramping type of pain or like stretching type of pain during the pregnancy. That is all due to this tight muscles or the tight area during the pregnancy, which can be relaxed to some extent by doing exercises.
Ma'am, is there any remedy for for that stretch marks? I have heard that you can use that moisturizer cream, but some people are telling if you do not, the skin color will of the baby will be dark. So don't. So we know that it is
Nothing
a
like that.
false.
Yeah, like stretch marks as such, nothing like no treatment is there. You can apply moisturizers like just to decrease that itching sensation you are having over your abdomen. What you can do is like once your pregnancy is over, once the hormonal changes, everything is gone, the discoloration, everything will be gone off. What you can do is like tummy tuck exercises you will be seeing in YouTube, and it will be like so common that you see after pregnancy loss weight, like weight loss exercises that you can do to reduce your tummy, like to strengthen up your muscles. That can only be done to reduce the stretch marks. If once your skin is back to your normal pre-pregnant state, the stretch marks will be like so lightly only visible.
Yes, ma'am.
Ma'am, one more doubt, ma'am. It's regarding the gestational diabetes, ma'am.
Yeah.
So I'm a mother of 3 kids, ma'am. So during my first pregnancy, I had gestational diabetics and I used to take insulin. And for the second and third, everything was fine, nothing, no problem was there. But is there any chances, ma'am, for me getting diabetic later on?
Yeah.
In future or in pregnancy, ma'am?
Future, ma'am, no pregnancy hereafter. That's it.
That's what you
That's
can specify.
So what the thing is like, if you're prone to get a diabetes in pregnancy, if you're having a strong positive family history of diabetes, maybe your parents, your father or mother
my
may be
grandparents
diabetic.
had. My grandparents had.
Yeah. So any family history of diabetes, you may be having a high risk of getting diabetes during pregnancy. The next thing is if you are obese during pregnancy, or if you're having a high sugar intake during pregnancy. As such, pregnancy, as I discussed, is a diabetogenic state. Like you are having so much prone to get diabetes. So it is okay to have like diabetes in one pregnancy and not to have it like next 2 pregnancies. It is because some growth factors are released from your body during your pregnancy, like insulin like growth factors or some hormonal changes, you are getting this diabetes. So once you are having diabetes in pregnancy, there is like 50-50 chance like you can have diabetes. And some people maybe throughout, like they may get diabetes in pregnancy which may last throughout. Like they will be have to take tablets or insulin throughout after their pregnancy also. They can land up in plain diabetes mellitus, which we see commonly in older age group. So there is a chance of getting diabetes. What you can do is like strictly monitor your blood sugar level. Like every 3 months you can check your HbA1c level. If it falls under 6.5, you can see, or you can just do your fasting blood sugar and postprandial after eating your blood sugar, like after eating 2 hours post your breakfast or like the meal, you can check your sugars, and to like strict monitoring of your sugars will keep you fit.
Okay. Thank you, ma'am. Thank you.
Any other doubt?
I think no. Ardi, ma'am?
And yes, ma'am. One doubt, ma'am. If ma'am, in my last pregnancy, there was I have that high BP, so that so that so that I go through that C-section. So when is it happen again? Is it will it happen again in the next?
Last pregnancy means you're pregnant for the first time last time?
Yes, ma'am.
Okay, so this hypertension is in pregnancy is due to the, like as I discussed, as in this diabetes in pregnancy, it is also due to some hormones which is released in this pregnancy. So what it is absolutely like, you can not have a hypertension in your next pregnancy if you had one, but you should be so careful so that you don't have excess of salt. Some people used to say like pickles, peppers, and all you should reduce. So it like if you eat salt also, like salt restriction is absolutely for like non-pregnant patient with hypertension is there. No, like old age people with hypertension, we used to suggest salt intake should be reduced. But as it's in pregnancy, there is no what advice to be given to a pregnant lady to like what to prevent hypertension. What you can see is like monitoring your blood pressure values and frequent monitoring of your blood pressure values. Normally in pregnancy, your BP will be like lower. Like if you're having a normal range of 120/80, it will be decreased to around 170 during your pregnancy. It will be like your BP will be low. But if you're having a high BP during your next pregnancy, also you should be in a like regular monitoring. You can buy a like digital BP apparatus, or if you're having a clinic nearby, you can go and monitor your BP once in every week. And if you're having any symptoms of headache, nausea, vomiting, blurring of vision is there, any like epigastric pain is there, swelling of your legs is there, or like decreased urinary output. If you are going 5 times per day and if only 1 or 2 times you went like the day, you should go and meet your doctor. And once you have hypertension, as I discussed with diabetes, you're having a chance of like getting that hypertension like after your pregnancy also. So you should take an adequate care for that. As such, like because of the placental hormones only, so it cannot be said that you will have hypertension in your next pregnancy.
Okay, ma'am. Thank you so much.
So anyone have any doubts, Aparna ma'am?
Ma'am, I have a doubt, doctor. There is a case called restless leg, no, not the swelling or that leg cramps, but some kind of restlessness where we are not able to sleep in the night, some kind of restlessness, that irritation kind of feeling. We cannot say what it is. I read it somewhere, it's called restless legs during the pregnancy. Is there any remedy for that?
Muscle cramp itself, no?
Yeah, like muscle cramp only.
Not muscle cramp.
Like,
it's not that
Maybe
pain,
like
but it's
in
irritation.
Malayalam we say that you know.
Yes, that one.
And now also we are getting now, even if we are sitting for a
Is it the numbness, ma'am?
No, it's very.
Is it numbness?
Not
That
numbness,
is like
some
you're
kind of
not feeling
irritation, I will say. Feeling.
Okay.
But here we are feeling some kind of irritation is there.
Okay, what you can do is like make your muscles do work for so long. Like you should be active throughout. You can do like exercises. What you have to like, as I already discussed, you should not wear a high heeled chapel during your pregnancy. And like throughout your like not, if you're not even not pregnant also, like for any functions only wear some high heel chapel, or else like mostly try to use a flat chapel, because your back pain also will be increased if you are having a like high heel chapel. Next thing is like some vitamin tablets like magnesium tablets and all others to decrease these symptoms. It is like if you are not having a proper blood supply to your muscles, this like cramp like things will be there. So what you have to take care is like be fit, and like if you're having the same symptoms throughout your pregnancy, even after taking care like so much of like food പിടിച്ചതിന് ശേഷം, if you're having this type of symptoms, you should go and consult. So the doctor will give some multivitamin tablets only, mostly they will suggest, like to increase the blood supply or the nerve supply to the muscles daily.
Thank you so much, doctor. Thank you.
And
One doubt, ma'am.
Okay.
This is doubt section what finish.
Okay, ma'am.
We can firstly give the doubt section. That was better idea. Yes, ma'am. Fast. Okay. She was be there for more than 1 hour.
My first baby aborted, ma'am. Growth not growth well. Second baby again aborted and not growth well. I have only one kid. That is the third baby.
Okay.
Third baby is okay. Fourth baby again aborted. Now I don't know why should ma'am all babies are aborted, not growth well, ma'am.
Okay. Like, can I just ask you what period of gestation it got aborted? Like, was it before 3 months or after 3 months?
2.5 months. That's problem.
Okay. Heartbeat had like appeared.
Yes, ma'am. Heartbeat. No,
Heartbeat
ma'am.
was there? No. So like mostly if you're having abortions, frequent abortions, like you should be evaluated for that. But one or two abortions is absolutely okay. Like in between also you had a delivery, like you had a like baby in between, it's okay. And mostly if you're having abortions during the first 3 months, we will just attribute it to a baby's cause. That is, if the baby's growth is not adequate, if the baby is having some abnormality in its growth or in its like constitution, like we'll say any genetic abnormality, any chromosomal abnormality for that baby, it is nature's law to get it aborted. If the baby is not healthy, the baby will not grow. That may have like maybe in your case it might have had happened, and it like in every pregnancy it may not happen. Like we cannot correctly say, but if you're having more than 3 abortions, that is consecutive, like first, second, and third abortion, or if you have a normal delivery, then 3 abortions, more than 3 abortions, recurrent pregnancy loss, you may have to get evaluated for any other problems like you're having to get frequent abortions, like APLA screening test and all other, like antiphospholipid antibody syndrome, like that. Some other diseases are there which can also cause frequent pregnancy losses, which have to be evaluated.
Okay, ma'am. Okay, thank you, ma'am.
Ma'am, thank you so much. Now, anyone else have?
Ma'am, I have.
Aarti ma'am was asking one doubt.
Okay, then Aarti ma'am.
You can proceed, ma'am. Aparna ma'am.
Okay, ma'am. I have a doubt that my doctor said that like 2 weeks after for scanning. That what is
Actually,
the
she is pregnant, ma'am. Okay, that you want to tell first.
Yes, I am right. Yes, my doctor said that just check up. Like first I have gone and the doctor said like 2 weeks after I have to look because the baby's growth. I think she's telling the baby growth. But is it like risk case or something? I just asked, but she's
No,
not
like
telling.
was your pregnancy spontaneously conceived or in infertility treatment treated
Yes, ma'am.
conception?
My like PCOD I have, so I just taking
Okay. What all
from this doctor.
medications like? Okay.
Hmm.
Like IVF treatment, anything was taken or like
No, ma'am.
naturally you conceived?
Yes, ma'am. Just like medicine give me and I just take it.
Like you and your husband had intercourse, then you conceived,
Yes.
right?
Yes, ma'am.
Like no IVF treatment, no IUI.
No, ma'am.
I think you might have gone through ovulation induction. The one tablet may have been given from the day 2 of your cycle, day 2 or day 3.
Yes, ma'am. So many medicines are giving.
Okay, so mostly like because it is this is your first pregnancy, ma'am.
Yes, ma'am. My first pregnancy.
Okay, okay, like maybe because they are thinking it as a precious pregnancy, they are like taking care so much. Okay, like
Okay.
it's okay to like mostly in a low risk pregnancy or any pregnancy, we will suggest only 5 scans to be done. One, as I discussed, it is around 8 month, say 8 week of pregnancy. That is two month of amenorrhea. The next is around 3 months. Then the next scan is around fifth month. They discuss anomaly scan, and the next 2 scans are for growth, like around seventh and ninth month we'll be checking. So mostly 5 scans will be adequate. So if they are asking for like frequent scans, they like maybe do check for the baby's growth. If any blood supply anomalies are there, and they are considering this pregnancy as a precious one because you may have conceived after a long period of infertility.
Yes, ma'am. After 4 years of marriage, now I am getting
Okay.
conceived.
So
Yes, ma'am. Then is it like bad for baby and all that scanning is going for?
no, scan is absolutely normal. You should not have an X-ray, CT, like radiological. This is just sound waves are going in through that one thing will be there. No, they'll be doing like this one probe. That
Yes,
is
ma'am.
just sound waves are going. It will not affect your baby. It is not at all harmful for your baby. And your
Okay,
doctor
ma'am.
will not suggest like mostly nothing harmful. Like they'll not suggest anything harm which may cause harm to your baby. So don't worry for that. If your baby's growth is adequate and if you're going through at least 34 weeks of your pregnancy, you will have like good delivery time.
Okay, ma'am. Thank you, ma'am.
Yes,
Thank
thank
you.
you so much, Kavitha ma'am, for your time.
Thank you.
Now I'd like to welcome our Shafna ma'am for a vote of thanks.
Yes, ma'am. So, good afternoon, everyone. So, I take this great privilege to thank each and everyone on behalf of our 34th NCDC batch. So, I present my gratitudes to each and everyone who had given their presence in this session. And also I like to extend my heartly gratitude and vote of thanks to our hello.
Hello.
Yes, ma'am. Yes.
And my vote of thanks to our chief guest, Dr. Kavitha SHENOY, Doctor of Vijaya Hospital, Chennai. Thank you so much for your precious time, your valuable time that you have come here. You have shared your thoughts, and which was really informative for every one of us, because many of us have going through motherhood, pregnancy time, and some of us are waiting for their pregnancy time to conceive. So thank you so much, ma'am. Thank you so much for in such a short notice. You have come here and you have presented a very good and like informative points on this mother and pregnancy time. Thank you so much. And thanks to our Sana ma'am, the faculty. Thank you so much for ma'am for arranging this function, and to all my batchmates. Thanks everyone to be presented here and to make this event and to make this section wonderful. Thank you so much.
Thank you so much everyone for inviting me also. Like it was like a stress-free class which I had taken, and this is my first experience, and thank you for calling me.
It was wonderful, ma'am. It was
It was
wonderful.
It
wonderful,
was
ma'am.
really
Our
wonderful.
sincere gratitude
Superb, ma'am.
towards you.
Yes,
Thank
ma'am.
you so
From
much.
bottom of my heart, ma'am, on behalf of everyone, once again, thank you very much. And moreover,
Thank you
you
so
have
much.
explained everything clearly, ma'am, from the beginning. Each trimester, you have come across each trimester, what all food to be taken, what are the medications to be taken, what are the vaccinations, everything you have come across, explained very well in detail. We are indeed very much grateful to you, ma'am. Thank you so much.
Thank you so much. Thank you so much.
Yes, ma'am, and thank you so much, Kavitha ma'am, again. And hope you will have a touch with us all.
Yes.
Sure.
Definitely.
Yes, ma'am. Then
Thank you.
we can wind up the session with the national anthem. Come on.